In Hawaii, they had proposed to raise the minimum legal age to 100.
It's been
100
years.
Persons who do not start smoking before the age of 21 are unlikely to ever begin.
2020 in Singapore started off with a few legislations taking effect, and one of them was the raising of the legal age limit for smoking to 20 years old. Despite Singapore implementing tobacco control policies since the 1970s and reportedly having one of the lowest smoking prevalence rates globally, youth smoking is still an issue, with an average of 6.5% of 13 to 15-year-olds picking up smoking. Previous research has also found that those who pick up smoking at a younger age are less likely to quit. Speaking to Dr. Yvette van der Eyck.
I am an assistant professor in the NUS Salzburg School of Public Health, and my research specialty is in tobacco policy.
She talks about the rationale behind raising the age limit for smoking to why young smokers find it harder to quit.
The main advantage is that it reduces youth access to cigarettes. So the point is to delay the age of onset of smoking. These few years between age 18 and 21, these are a critical time period when a lot of those early experimentations turn into full-on addictions. This is a time when, developmentally speaking, you're much more prone to getting addicted to products like cigarettes and other addictive products too. Basically, the later someone starts, the less likely they are to become, daily addicted smokers later on in life. The main disadvantage is that obviously, people who are in that age group who are then getting restricted access to cigarettes, they won't be able to start smoking. So they might see it as a restriction on their freedom of choice. But in the broad scheme of things, when you look at the public health benefits and the addictiveness of cigarettes, that must be weighed up against those benefits as well. So really, it's a minor restriction for a greater cause. When it comes to making comparisons between tobacco and alcohol, it's important to remember that they're very different products, and the kind of harms, both on a physical level and on a societal level, that you get from both products are really quite different. So with alcohol, a lot of the harm is not necessarily from the addictiveness, because alcohol is nowhere near as addictive as cigarettes. It's more from the societal impact. When people get intoxicated, they get violent, they get a bit disorderly. These are the kind of societal harms that we get, that we don't get much with smoking. But with smoking, the addictiveness is far, far more severe than with alcohol. Cigarettes, you smoke them, so the drug goes to your brain within seconds, so the hit is much stronger. And the addictive impact, when you look at the pharmacology between, alcohol, tobacco, and many illegal drugs, the addictiveness of cigarettes is right up there with heroin and crack cocaine. It's an extremely addictive product. If the goal is to protect people at a time when they're more prone to developing addiction, then you really ought to have stronger regulations for something like cigarettes as compared to alcohol. The government has not reflected any plans to raise it further than age 21. There is the possibility that they might consider it, and it would actually not be a bad idea. There has also been talk of tobacco-free generation. So this was actually an idea that came from researchers in Singapore who were advocating for this idea. So this is a proposal to ban cigarette sales to anyone born in or after the year 2000. So those who are currently turning 20 this year, they would not be able to buy cigarettes regardless of their age in the future. In Hawaii, they had proposed to raise the minimum legal age to 100. It's a very tough question to answer because it depends on how far in they are with their smoking habit and their addiction. If the young people have been getting addicted, they do still need quit supports as much as adults do. And they're often a neglected group when it comes to things like smoking cessation services, because often smoking cessation services are catered for the older folks. They don't always cater for those young people who are only just becoming addicted. Well, the real question should be, what are not the health effects of smoking? Because there's so many. Smoking literally affects every organ and system of the body, everything. In the short term, people will find that it affects their fitness. Addiction would be an obvious one. Cancer, all these very serious chronic diseases, all of these tend to onset later in life, but they can affect younger people as well. There have been cases of people in their 30s, as young as that, getting cancers and lung diseases, for example. Actually, today, one country has banned cigarettes completely, and that is Bhutan. Yeah, but Bhutan is quite a special case. You know, a lot of the public health advocates have been talking a lot more in recent years about this tobacco endgame, which is that we should be working towards getting rid of it completely at some point or other. So I think it's something that we should work towards. That doesn't mean that most countries aren't ready for it now, because I think in a lot of countries, smoking rates are still, near 15 or 20%. So you can't just ban it overnight. It's an effort where you have to just keep working with the different policies, and then slowly smoking prevalence will drop. And then when it gets to the point where it's quite a rare sort of behavior, no one really smokes anymore, then you can just say, okay, let's just ban it altogether.